Hello friends, my name is Dr. Rahul Bhalgami and I am a practicing gastroenterologist. At present I am practicing in Ahmedabad, India. Today I am going to discuss about GERD, the commonly known as a gastroesophageal reflux disease. Now we are seeing more and more patients of GERD because of recent change in the lifestyle, recent change in the food patterns of the patient and rising anxiety level in communities. Now what is GERD? So as the name suggests, GERD is a gastroesophageal reflux disease. So if I tell you in a simple term, the contents in your stomach, that is mostly acid and the food which are present in your stomach, it comes in the esophagus and it will lead to various symptoms. So that is the basic mechanism of GERD. Now let me explain you in this figure. This is the stomach esophagus and this is the stomach. When you take the food, it goes in the esophagus and then in the stomach. But there is a valve between the esophagus and stomach that is called as a lower esophageal sphincter. Normally what happens that this valve will close when your food enters in the stomach. But in patients with GERD, this valve remain open, and because of that the food and acid which is present in your stomach will enter in the esophagus and will lead to various types of symptoms. Now what are the symptoms of GERD? Commonly the patients come with heartburn, that is the burning sensation in the chest or in the upper part of the abdomen. This is the most common presenting symptom in patients with GERD. There are lots of other symptoms also, say for example soreness or bitter taste in mouth, chest pain, chest discomfort, and regurgitation. That means the food which patient has taken recently will come in their mouth, particularly when they are in lying down position. So these are the various presenting symptoms of GERD. If you don't take treatment and if this persists chronically, then esophagus will become narrow, and that is called as a stricture, a peptic stricture. Because of the stricture, then the patient will have difficulty in swallowing, and ultimately in a chronic term it may lead to development of adenocarcinoma, that is cancer also, but that takes a very long time. Now why this occurs, why the valve remain open, and what are the cause or etiology of the GERD? The common is obesity. Obesity is one of the common cause of GERD that lead to the relaxation of the lower esophageal sphincter and reflux of the acid and the gastric content into the esophagus. Now what are the causes of GERD? The most common cause of the GERD is the overweight. Overweight of the patient will lead to the relaxation of the lower esophageal sphincter, and these symptoms of the GERD occurs. Also the lifestyle changes. Because of the sedentary lifestyles, patient used to go to sleep immediately after taking the food, and because in the lying down position it is easy for the gastric content to come in the esophagus, and that will precipitate the symptoms. Many patients comes that after sleep of about 1 to 2 hours, they have to suddenly wake up because of the chest pain and because of the bitter taste in their mouth or because of the breathing difficulties. This occurs because of the GERD. The gastric content enters into the esophagus in the midnight, and then patient will develop this type of the symptoms. A lot of patients say that whether there is any particular diet which can lead to the GERD or whether the stress lead to the GERD. I would say yes. Rising stress level will lead to increased symptoms of the GERD. Rising stress level will increase the acid in your stomach, and those patients who are having a relaxed lower esophageal sphincter will have more reflux and more symptoms. Any particular diet? So yes, there are a lot of diet which relaxes your sphincter, like increased fat in the diet, chocolates, coffee. These are the certain types of the food which relaxes your sphincter and will lead to the rising symptoms. Now, how to treat this? GERD basically is mostly a lifestyle related disorder. So I would advise the change in your lifestyle will benefit a lot in addition to medicines. Now what are the lifestyle modification I would advise? The most important is reduction in the weight. if you are overweight, then reducing the weight is going to help you a lot. Reducing the weight will make your sphincter function more like a normal, and this will prevent your symptoms. The another important lifestyle change is if you are taking tobacco, if you are taking smoking, or if you are taking excessive alcohol, then I would advise to stop it because these are the most important factors which lead to rising GERD symptoms. Certain drugs like patients who are chronically taking analgesic should reduce their dose of analgesic to reduce symptoms. And what are the different medications available to treat the GERD? There are a lot of medications available. Commonly the patients used to take over-the-counter antacids which are available, but the antacids will be effective for some times, but on a longer run they lose their efficacy and patient will have to switch to higher medication. So I would advise that those patients who are suffering from these symptoms should avoid taking over-the-counter medication for a long time and should consult their doctors or gastroenterologists for proper diagnosis and proper management. The other group of the medications which are available are H2 receptor blockers like ranitidine or famotidine, and recently more better, more powerful and more safer drugs like proton pump inhibitors are going to help a lot in the management of the GERD symptoms. So various PPI like pantoprazole, rabeprazole would be prescribed by your doctors, and patient need to take these medications regularly in addition to lifestyle modifications. So this is how they are going to relieve their symptoms. Thank you.